Welcome. Today we're diving into the fascinating and potentially life-threatening world of botulism, a rare but serious paralytic illness caused by a toxin produced by the bacterium Clostridium botulinum. Join us as we explore the causes, effects, and what can be done about this neurotoxin-mediated disease. Botulism is caused by the neurotoxin produced by Clostridium botulinum bacteria. These bacteria thrive in low-oxygen environments, such as improperly canned or preserved foods. They can also be found in soil and can contaminate wounds. The toxin itself is incredibly potent, making even tiny amounts dangerous. While foodborne botulism is the most well-known, infant botulism and wound botulism also exist. Infant botulism happens when infants consume Clostridium botulinum spores, which then colonize their intestines and produce the toxin. Wound botulism occurs when the bacteria infect a wound and release the toxin into the bloodstream. Once ingested or produced within the body, botulinum toxin targets the neuromuscular junction, the point where nerve cells connect with muscle cells. Specifically, the toxin prevents the release of acetylcholine, a neurotransmitter crucial for muscle contraction. By blocking acetylcholine, the toxin effectively paralyzes muscles, leading to a range of debilitating symptoms. The paralysis typically begins in the cranial nerves, affecting the eyes, face, and throat, and then descends down the body. Botulism is relatively rare globally. Foodborne botulism is most often associated with canned foods that haven't been properly sterilized. Infant botulism is the most common form of botulism in the United States, and it is often linked to honey consumption in infants under 1 year of age, as honey can contain spores. Wound botulism is more common in people who inject drugs. While outbreaks can occur, botulism is typically seen as sporadic cases rather than widespread epidemics. The symptoms of botulism can vary depending on the type and severity of the case, but they generally follow a pattern of progressive paralysis. Early symptoms often include blurred or double vision, drooping eyelids, slurred speech, difficulty swallowing, and dry mouth. As the paralysis progresses, it can affect the respiratory muscles, leading to difficulty breathing and potentially respiratory failure. In infants, botulism can manifest as constipation, poor feeding, lethargy, a weak cry, and a loss of head control, often described as a floppy baby syndrome. Diagnosing botulism can be challenging due to its rarity and the non-specific nature of some of the early symptoms. A doctor will typically start with a thorough physical examination and a detailed medical history, focusing on recent food consumption, wound history, or potential exposure to the toxin. Laboratory tests can be performed to detect the botulinum toxin in the patient's serum, stool, or wound samples. Electromyography (EMG), a test that measures the electrical activity of muscles, can also be helpful in confirming the diagnosis by showing characteristic patterns of muscle weakness. Botulism isn't really classified by subtypes, but rather by how the toxin is acquired. We differentiate between foodborne botulism, caused by ingesting food containing the toxin, infant botulism, which occurs when infants ingest spores that colonize the gut and produce the toxin, wound botulism, when the bacteria infects a wound and produce the toxin there, and iatrogenic botulism, a very rare form that can occur from overdoses of botulinum toxin used for cosmetic or therapeutic purposes. Treatment for botulism focuses on neutralizing the toxin and providing supportive care. The most important treatment is the administration of botulinum antitoxin, which binds to the toxin circulating in the bloodstream and prevents it from affecting nerve endings. Antitoxin is most effective when administered early in the course of the illness. Supportive care includes mechanical ventilation if the respiratory muscles are paralyzed, and nutritional support if swallowing is impaired. Wound botulism may require surgical debridement to remove infected tissue. It is important to note that antitoxin does not reverse the effects of the toxin that is already bound to nerve endings. Recovery depends on the regeneration of new nerve endings, which can take weeks or months. Prevention is key to avoiding botulism. Proper food handling and preparation are crucial, especially when canning or preserving foods at home. This includes using proper sterilization techniques, pressure canning when appropriate, and discarding any food that shows signs of spoilage, such as bulging cans or foul odors. Honey should not be given to infants under 1 year of age to prevent infant botulism. Proper wound care, including thorough cleaning and prompt medical attention, can help prevent wound botulism. The prognosis for botulism depends on the severity of the illness and the promptness of treatment. With early diagnosis and treatment, many patients make a full recovery, although it can be a slow process, with muscle strength returning gradually over weeks or months. In severe cases, botulism can be fatal due to respiratory failure. Research continues on developing more effective antitoxins and therapies for botulism, For example, scientists are exploring new antibody-based treatments and investigating the mechanisms of toxin action to identify potential drug targets. Recent advances also include the development of more rapid and sensitive diagnostic tests.